Assalamualaikum everyone, welcome back to this channel. So this is me Arya Wahid, and in this video we are going to start the next chapter of Pharmaceutics dosage form, and this chapter is about the parenteral preparations. So in the previous lecture we have discussed about the tablets, about the capsules, about the powders, but now we are going to start another chapter which is the parenteral preparations. They can also be called as injectables, mean you are going to inject something in your body, so they are directly administered into your blood. So we have discussed about the tablets, they are given orally, mean you taken them through the mouth. But now these are the parenteral preparations which are injected into your body and they directly enter into your blood. But in case when we study that when we give the patient oral administration, then first it will go through your GI tract, then after that it will absorb, and then it will enter into your blood. So this is actually a direct method to enter your drug directly into your blood, but it contains some properties, otherwise it cannot be injected. Like what kind of properties it has? First of all, its nature can be aqueous, can be oily, can be in the solution form, can be in the suspension form. So what is solution form? In which solute is dissolved in a solvent, but in suspension the particles of solute are not dissolved, they are actually suspended in the solvent. So this is the difference. So now not all the injections are aqueous, oily, and solution and suspension form. There are some injections which are in aqueous form, there are some injections which are in oily form, there are some injection in the suspension form. So now we are going to discuss the second property of it, which is the sterilization. Mean it should be sterilized from all the kind of microorganisms, bacteria, fungi, and protozoans. And second thing is should be isotonic, mean it should be equal to the atmospheric pressure, and its pH level is adjusted to your blood. So if it has a low pH and higher pH than the blood, then it will cause serious type of reactions with your blood and may cause adverse effect of it. Last is the free of contamination. All the physical contamination, chemical contamination, and microbial contamination should not be present. So that is very important. So when we are going to prepare these parenteral preparation, we should be take very much care of the contamination. We should not allow any kind of contamination, whether it is physical, whether it is chemical, or whether it is microbial, to enter into that preparation. Now we are going to discuss about the routes of administration of parental products. So there are two routes. First is the common route and second is the specific route which is not common. Now let's discuss about the common routes. So these are the common routes which are intradermal. It can also be called as intracutaneous. Then subcutaneous, it can also be called as hypodermic. Intramuscular, intravenous, and intraarterial, these are the most common routes. But these are the specific routes which are not common, like intracardiac, intrathecal or intraventricular, intracisternal, peridural, intraarticular, and intracerebral. So now we are going to discuss all of these routes in the table, and then we will discuss that what are the characteristics of them. So here is the table which I have made for you. So first we are going to discuss all the routes here. These are the location of an injection, that where is the particular injection should be injected in a particular site of your body. Then we also discuss their absorption speed, the volume of injection you can inject it, and the uses of that route. Okay. Now first of all, let's discuss the intracutaneous and cutaneous route. Okay. So intradermal route, okay, I have again written it, so please correct it. So where it is injected between the dermis or epidermis layers. So dermis or epidermis are the layers of your skin, so they are injected in it, and they are injected in the skin of left forearm. So your left forearm, this skin should be uplift, and after that the patient detected the skin of that particular patient, and then we will inject that injection. The absorption speed of this injection is very slow, so it is causing extended release effect of that drug. Volume of injection should be 0.1 to 0.2 ml. Above the volume of this injection will cause serious kind of side effects. And last is the use of that route. So it is used for testing the sensitivity and also used for test for the diagnosis of allergy. So when you have allergy and you have to find that what from which you have allergy, so the what will happen, we will make a circle around your skin and then we will inject particular allergens into your skin, and after that we can detect that whether the patient have allergy with this particle or not. So they are these particles are injected in between the dermis or epidermis in the left forearm, are called as intracutaneous injections or intradermal. Then again, second route is subcutaneous or hypodermic. Okay, subcutaneous mean it is injected into the subcutaneous tissues of your body. So in your skin, various kind of subcutaneous tissues are present in the below area. So its absorption speed is moderate, almost, and the volume it should be less than 1 ml or equal to 1 ml. So it should be 1 ml or in 0 point something digits volume. And it is mostly used, okay, so it is mostly used in your injections. Then it is the intramuscular, and as its name indicates, now we are giving the injection in the muscles, where the muscles in the muscles of shoulder, thigh and buttock. The absorption speed of this injection is very slow, so it is causing the extended release effect. The volume of this that injection should be from 2 ml to 4 ml, but should not be exceeded from the 4 ml. Then it will cause adverse effect. And the uses of that route should be, it should be in the form of depot preparation. What are the depot preparations? They are in the form of suspension. So what is the suspension? You know that the solute is not dissolved in the solvent, whether it is suspending in that solvent. So we can give oily preparations if through the intramuscular injection. So there are various drugs which are in the form of oil, so they can be given through the intramuscular route. Then there is the intravenous route. Now the injection is given in veins. Near the elbow, a vein is present which is called a basilic vein. In this vein, we are going to inject that injection, and the no absorption is required for this process. So therefore, we cannot detect the absorption speed. Why the not no absorption is required? Because intravenous is directly entering into your vein, and then actually this basilic vein is surrounded by or is connected to various veins of your body. So then it will goes to your whole body, the drug will circulate it out, find out the particular area through which it has to be perform its action, and after that you will observe the pharmacological action which should be occurred. Then let's discuss about the volume of injection. So volume of injection should be from the 1 ml to 500 ml. So it has a large range of volume of injection, so it is most commonly used in our daily life. So one thing you have to remember that the drug should not be in the form of oil or in the form of suspension. Only aqueous and the solutions are given in the form of intravenous injection. So this is very drawback, that if a drug which is oily, it cannot be given through the intravenous route, it can be given through the intramuscular or the other routes, but intravenous cannot be given through this preparation. Next is the intra-arterial. Arterial mean the artery. Now we are giving the injection in the artery. It has no absorption speed or volume because it is not used commonly. It is only used when we have to give the immediate effect, because arteries are going back, going away from the heart, so therefore it is circulated more in the body. But they are rarely used, not commonly used in our daily life, so therefore their absorption speed is not given. Next, these are the other the routes which are given. They are not common in daily life. They are used when we have very rare case. So the first is the intracardiac. Now the injection should be given in the heart muscles or in the ventricle of the heart. So when it will given in the only the emergency case. The next is the intrathecal, or can also be called as intraventricular. So it is given in the subarachidonic space around the spinal cord. So you know about the layers of the um, So you know about the layers of meninges. So subarachidonic acid, subarachidonic space is the layer of your meninges. This is the layer which is present between the arachidonic layer and between the dermis layer. So in that space, this injection is given. What is the purpose of that injection? It is used to give the spinal anesthesia. So when we have given the patient anesthesia, sometimes it should be given to the patient in the spinal cord, but it has a lot of side effects, like after that injection or that operation, the patient will feel the back pain in his whole lifetime. So it is very rarely used when they have no options left. So next type of injection is the intracisternal. So it is given in the first and second cervical vertebrae. And similarly, the use of this injection is to take the CSF, the cerebrospinal fluid, out of your body, and also used for the diagnosis purpose. The next special injection is the peridural. It is given between the dura mater and the inner vertebra in the vertebral canal. You can say as a vertebral canal. So it also used to give the spinal anesthesia to that patient. So now the other routes are intra-articular route. So it is the liquid that lubricates the joint. So it is given in that liquid which is lubricating. You know that like this is a joint of me. So in between the joint is present and is connected the two bones. So now this joint, the liquid is present. Let's suppose the liquid is present here. So the injection will given at that point. So it is very rarely used, not used, used when it has we have a rare case. Last is the intracerebral. So it is given in the cerebrum of your brain and it is not used commonly. Now I have discussed some advantages and some disadvantages of parenteral preparation. So what are advantages? So it has rapid action, use in emergency, no first part metabolism, use for the patient which is unconscious and non-cooperative, for the prolonged action in the form of solutions or volumes, don't go to your JIT. So this is the benefit of it. Now it has some disadvantages, like it is quite expensive, cause the pain, tissue necrosis, mean damaging the tissues. And also if it is administered into the wrong place, like I am giving a patient injection in the basilic vein, but I have displaced it from that side. Now when it displays, then it will cause, it can be fatal or cannot be. So if it fatal, then it will cause the death of that patient. So this was all about the today's lecture. I hope that you will like this video. In the next video, we will discuss about the formulation of parental preparation, that how we are going to formulate it and how they are prepared. And we will also discuss some their types on the base of their solution form or in the suspension form. So this was all about the today's lecture. I hope that you will like it. Make sure you have to subscribe this channel and like videos to get more videos which I uploaded in the future. So take care. Meet you soon. Allah Hafiz.